So what made me decide to do TMS? I decided to do TMS finally. It was a culmination of things, but what really triggered it was postpartum depression. I heard that it was a thing. My doctor talked to me about it. I was talked about it in the hospital after my son was born, and I thought I was fine. Some weeks into him being born, I realized that I was kind of in a downward spiral and in a darker place, and I realized it was really bad when I ended up on the ground crying for hours at a time, which was not something I typically had done or had experienced in the past. Going back, I thought maybe that would be something temporary. Going back to work was really difficult with it because it was just managing those emotions on top of the stress of everything at work. Did I take any medications before starting TMS? So I had been on a low dose of Lexapro, primarily for POTS treatment. It's one of the medications that they prescribed with POTS, with postural orthostatic tachycardia syndrome. And I had taken Lexapro in the past for anxiety and depression, but I was down to just 5 milligrams, so nothing more than that, but steady low dose. What was the TMS experience like for me? I thought it was a good inward look. It was a lot, 8 to 10 hours in a day. In the beginning, I think there was partly, us trying to figure out, me and the other patients trying to kind of figure out our schedule, our routine, what every day would look like. But in the end, it ended up kind of being a rhythm, treatment, time with a health coach, time to reflect and kind of step away from work, be outside. What did the TMS treatment feel like? That's hard to describe. I remember hearing something about it feeling like these snapping rubber bands, like if someone was snapping a rubber band on your head. And it kind of did, just stronger, I guess. I wouldn't call it painful, but it was definitely a little bit uncomfortable. I want to say, if you've ever had TENS units on you for physical therapy at all, how am I feeling now? Months out from TMS and the progression of how I got here. There's still the stress of, of having, being a new mom and dealing with work, and there is still that anxiety and I think being a mother to your child, which I'm not sure if that's ever really gonna go away, but there isn't this intense looming emotional drag is the only way I could describe it. The best way to describe it is honestly just feeling like this cloud and weight was lifted, and not all at once. I feel like everything made me cry. So just that was kind of how it started. Feeling like, okay, I can gather myself, I can breathe, I can think. And working with my health coach, we talked about meditation and just kind of working that in. How do I feel TMS has changed my life? I think one of the biggest things that I took out of the treatment, yes, there's the treatment, my me time and taking that time, whether it's meditating, I was pushing off a lot of things like biking every day, every other day, even if it was 30 minutes to an hour, meditative, or that kind of helps center you, because that is something I focused on after the treatment with the health coach, and it does make a difference. And just utilizing the techniques that I learned from the health coach, from some of the books that were recommended that I got plenty of time to read during the TMS treatment week. And yeah, just taking that time that I was in therapy, I was doing all the things that I did before and it wasn't helping. And I just feel like if you're in that spot with anything, this really helps. So yeah, I definitely recommend it.